It is, I think one of the worst cancers that women suffer from, and it's the worst cancer that you can die from. What I recommend is, from going ahead with the pain of cervical cancer, if you can just go ahead with this pain for a couple of minutes, I think it is really worth it.
So hi everyone, today we are here with a gynecologist, Dr. Dhwani Mago, and we're going to be talking about cervical cancer. So Dr. Dhwani, can we start with what is cervical cancer?
When people hear cervical cancer, they have in mind that is it the cancer of the cervical bone? I feel that is very important to know that what is cervix. So cervix is actually a part of the uterus, the lower part of the uterus. And I would want to get a model and show you, but it's the lower part which supports the uterus. Even during pregnancy, that is its main function is to hold the baby.
So guys, this is the model of the uterus, and here this is the cervical canal. So this is the organ that we are talking about where the cervical cancer happens.
I tell my patients that cervix is one organ that you can't see, so that is the reason it's very important that you get your yearly examinations done once you are sexually active. And internal checkup is very important, where we examine the cervix essentially and look for any changes happening in the cervix.
So cervical cancer essentially is like a tumor in the cervix, or is it growth like normal cancer what we associate with lung cancer or any other?
Yeah,
is it similar?
Yes, exactly. It is, I think one of the worst cancers that women suffer from, and it's the worst cancer that you can die from. So it's basically, abnormal cells, they start multiplying in the cervix, and it slowly starts eating away your cervix and then gradually your surrounding organs, which could include the bladder, the rectum. So that is the reason that, if you know that there is a prevention or there is a treatment, you must go ahead and take it.
So what causes cervical cancer? Are there any, for example, if you think of lung cancer, one of the possible causes could be smoking or something along those lines. Is there a cause for cervical cancer?
Yeah, so there are many high-risk factors which, promote cervical cancer. And, the best part is that all these factors can be changed. You can incorporate certain changes in your lifestyle that can prevent cervical cancer. So firstly, the most important factor is HPV virus, that is human papilloma virus. So lately, everyone's been talking about this virus and about cervical cancer. So this HPV virus is very prevalent nowadays. And it is, there are 150 kinds of these viruses. But the high-risk viruses are the ones which cause cervical cancer. Now, there are certain low-risk viruses which can lead to genital warts, so which is obviously seen in a lot of sexually active young adults. And what we notice is that HPV high-risk virus is also very common nowadays in the young adults. The fact is that in men, there is no way to check, there is no test as of now that we can check if a man has a HPV virus. But for women, there are tests and routine screening tests that we do to detect this virus. Now, this HPV virus, it causes certain changes in the lining of your organs, especially like the cervix, the oral cavity, the anal canal. And that is how these changed cells, they lead to cancer. They start multiplying abnormally and it leads to cancer.
So this HPV virus, is it, the way most of us know it, it's an STD. Is it just an STD or does it go beyond that?
So mostly this HPV virus is transmitted through sexual contact, either through normal vaginal intercourse or anal intercourse or even oral intercourse. So that is the reason in men, even this HPV can cause cancers. So in men, it leads to anal cancers, oral cancers, and penile cancers. And in women, it will lead to cervical cancers, oral cancers, and anal cancers.
You said there are 150 kinds of the HPV virus itself. Can all of them affect everybody, or there are certain viruses that women are more susceptible to, certain viruses that men are more susceptible to? How does that work?
In men, we cannot detect which viruses they are catching. But generally, if a man is symptomatic, they have genital warts, then those are generally low-risk viruses. They may not lead to malignancies. And in women, definitely there are the main HPV virus 16 and 18. That is the one that causes cervical cancer. So when we do a pap smear and an HPV DNA test, that is what we are looking for. We are looking for the high risk viruses. And in case you have these viruses, you must know that there is no cure, but it is like a virus. So it will go away from your body in about 6 months to 1 year. But there are certain factors like chronic smoking, or you having chlamydia infection, or if the immunity of the body is low, then this is the time when these viruses, they last in your body longer, which may lead to cervical cancers.
How can we test for these viruses? You said for men there isn't a specific test for this. So how do we test it in women? And then consequently, what can men do to find out whether or not they have it?
So for men, there is no test available. So the only way is prevention. And that is the reason that, the vaccines come in. And now the vaccines are there for boys as well. And we start giving it from 10 years onwards. Yeah.
Okay.
Yes.
So how would women... for men, they can take the vaccine, I suppose.
For women, yeah. So the screening protocol for women, definitely, that is a very nice algorithm that has been set, by experts. And what we say is, once you are sexually active, you start screening at 25 years of age. And you need to get this screening done once in 5 years. So we combine a pap test as well as a high-risk HPV DNA. And it's recommended that you do it once in 5 years. If you're only going ahead with a pap smear, you can repeat it in 3 years. And why? What is this test? Exactly. A pap smear is basically, we examine the cervix. It's a small speculum. Some women may face mild discomfort during the pap smear, and it takes hardly 3 minutes. So what I recommend is, from going ahead with the pain of cervical cancer, if you can just go ahead with this pain for a couple of minutes, I think it is really worth it. And so we just, examine the cervix with the speculum, and just with a brush, we sweep the cervix and send the cells for examination.
So the speculum is the brush?
No, the speculum is an instrument that we insert in the vagina to have a clear look at the cervix. And then with a small tiny brush, we just brush the cells of the cervix and send it for examination.
And this test can detect all of the 150 kinds of HPV viruses?
So yes, it detects mostly the high-risk viruses. We are not detecting the low-risk ones. We want to see the high-risk ones. So that's why it's called a high-risk HPV DNA test.
Okay.
Yeah.
You said there's a vaccine.
Yeah.
So can you tell me a little bit about the vaccine that's available? How does it work? Are there different kinds? Which is for men? Which is for women? A little bit, like a bit of a... Yeah.
So, I think we are very fortunate that this cancer has a vaccine, because there are n number of cancers that do not have any vaccines. So, we have 3 variants available as of now in India. So, the worldwide vaccine which is used is Gardasil, and that has 2 variants, Gardasil 4 and Gardasil 9. So, Gardasil 4 will mostly cover 4 strains of the high-risk virus. It's a quadrivalent vaccine. And Gardasil 9 covers up to 9 high-risk viruses. So, that is an advanced vaccine. And now lately in India, the Cervavac is launched, which is an Indian-made vaccine, and that is also a quadrivalent vaccine, which covers mainly the 4 high-risk strains of the cervical cancer.
And how many doses do we need to take? How long does the vaccination process last?
So the schedule is, you need 3 doses if you are more than 16 years of age. Up till from 10 to 16, we just give 2 doses. So ideally, the right time to vaccinate is at starting at 9 to 10 years of age for both boys and girls.
Isn't it when you become sexually active, or no, you can get vaccinated before?
No, the right time to start is around 9 to 10 years of age. Yeah, okay. So nowadays the pediatricians only, they have incorporated in their schedules that you start giving the vaccine as early as possible. So earliest is 9 to 10 years.
Wow.
Yeah.
And is it a one-time vaccine or boosters?
No, so it's a lifetime vaccine. So for the children from 10 to 16 years, it's 2 doses at 0 and 6 months. And for adults from 16 years onwards, it's 3 doses. So 0, 2 months and 6 months.
Okay. And how much does this vaccine cost? What is the efficacy like?
So, the costing varies according to your efficacy also. So, the Indian vaccine, I'll start, it's the lowest as of now. It's somewhere around, in private clinics, it's somewhere around 2,000, 2,200. The quadrivalent vaccine, Gardasil 4, is around 3,800. And the advanced vaccine, Gardasil 9, that is somewhere around 11,000 per dose.
So that one's quite expensive. So you'll be
Yes.
spending upwards of 30,000 for all the 3 doses.
Yes, definitely.
And you said that one targets 9 strains, whereas
Yeah.
the quadrivalent one targets 4 strains.
Yes. So why, we recommend Gardasil 9 as of now is that it will cover your oral cancers and your anal cancers as well. And for men, the only option is Gardasil 9. So because men don't have a cervix. So we are trying to prevent anal cancers, penile cancers and oral cancers in men. So for men, Gardasil 9 has to be taken. There is no other alternative. But for women, you have these 3 alternatives.
Wow. So, will this vaccine protect you from all sorts of oral cancers, all sorts of anal cancers, all sorts of penile cancers, cervical cancers?
So, not all kinds of cancers, but yes, cancers which are caused due to the HPV virus, right? So, there are multiple kinds of cancers. So, the cancers which are, caused due to the HPV virus, that is what we are targeting here.
And are there any side effects to taking the vaccine?
So, like any other vaccine, you can, get a mild arm pain because we generally give it in the arm. You can get an arm pain or a slight fever. And reactions, allergic reactions to the vaccine are very rare. So, you take any medicine also, there is a reaction to it. So, anyone can have a reaction, but then you have to see the pros and cons. So if you have a benefit of preventing such a drastic disease, I think you must go ahead and take it.
So I was, when I talk to people who are my mother's generation or my grandmother's generation, they generally have not taken a cervical cancer vaccine. But when it comes to people who are our generation or younger, we know about it. We may or may not have taken it.
Yeah.
Can you tell me if the vaccine, how new is it? Is it new? Is it old? And what happens if you've not taken it when you're 10 or 25? What is the age limit until which you can take it?
So, see, the age limit for this vaccine is for women is up till 45 years. And for men, as of now, the age limit is till 26 years.
Oh,
yeah.
Okay.
So the span for men is from 10 years to 26 years. But, it varies. If men want to take the vaccine, they can discuss with their doctors beyond 26 years and opt to take it. For women, the efficacy of the vaccine is excellent till 26 years of age, and especially if you are not, you've not had the HPV virus till that day. And after 26 years also, we do recommend the vaccine. Why? Because, there are many times that the women are not affected with the virus. So definitely you will get some immunity from the vaccine, if not 97%, which is, what the vaccine claims. The Gardasil 9 claims that it can prevent cervical cancers up to 97%. So that is, I think, a huge number ratio. So I think everyone should, all young girls and boys must take the vaccine.
If so you're saying the vaccine works best if you've never had the HPV virus. Is it possible that you could have had the virus and it fixed itself, and then when you get tested as a woman, if you're getting tested, then you don't test positive?
Yes, definitely. So, the immunity of the vaccine will come over once you are no longer having that virus in your body. Definitely, you will get the immunity. Obviously, not 97%, but yes, the ratio could be lower. But we do recommend. So, even after deliveries, if women have not, taken the vaccine postpartum, we are giving the vaccines.
And why is there sort of this age limit that for women up to 45, for men up to 26? Why is it there? Why can't you just take it?
So, the efficacy, like after 45, the efficacy will be very low. It wouldn't benefit you at all. And it is not a very, it's a costly, expensive vaccine. So the recommendations, the studies have been done, and I think all the brilliant people have decided on this number. So, like I said, if patients are wanting to go ahead and take it, they can discuss with their doctors beyond 45, and if they are willing, they can go ahead and take it.
The three kinds of vaccines that are available, they all start from, you said, 2,000 to
Yeah.
4,000 to 11,000.
Yes.
This is quite expensive. Are there any cheaper alternatives available? Are there going to be any cheaper alternatives available?
So, the government is planning to launch the Cervavac vaccine in the government hospitals. So, because, the lower strata is the one that really suffers because they don't have access to these vaccines and they don't have access to regular screenings as well. So, for them, definitely government is, taking efforts and planning to launch the Cervavac I think, at a very low cost. And that would definitely benefit a lot of women because the ratio of cervical cancer in developing nations like India is quite high compared to the developed nations.
Okay,
Yeah.
that's very interesting.
Yeah.
So we spoke a lot about the vaccine. Let's talk about cervical cancer itself.
Yeah.
How do you know what are the causes and symptoms? Causes,
Yeah.
one of them you said
Yeah.
was the HPV
So the main
virus.
causes are HPV, chronic smoking. In fact, even if we talk about women having chlamydia infection, they are more prone to getting HPV. And why smoking? Because during smoking you take so many toxins in your body that alters the DNA of the cervical cells, and that makes the HPV virus last longer in your cervix. So that is one reason. Low immunity. Another cause is low immunity, like patients who've had some organ transplants or with HIV. So people suffering from HIV are a very high risk to get this HPV virus. So for them, we recommend screening every year. So anyone who is immunocompromised will be at a high risk to get this cervical cancer. Now, how do you know that you have, what are the symptoms of cervical cancer and when you should go and see a doctor? So the most common symptoms are, you have irregular bleeding, you will have intermenstrual spotting, you may have bleeding after intercourse, after having sex, or you may have a bloody, foul smelling discharge. That is a very important symptom. And also sometimes when you've had your menopause, suddenly again you start having bleeding. So that is another symptom of cervical cancer. So you must go and get a checkup done from your gynecologist.
And what sort of treatment options are available if you go to your gynecologist and you realize something's wrong?
So, see, when firstly we go ahead with a screening, we have a look at the cervix, we take the pap smears. In case there are changes, there's a good thing about this cancer is that there are stages to it, you can detect it at a precancerous level as well. So that is the best part about screening, that if you are detected at a precancerous level, we can avoid the cancer developing in full form in your body. So during the pap smears, we check for any early changes happening. So if we detect any abnormality in the pap smear, we go ahead with a colposcopy. And colposcopy is like a very small procedure. Sometimes it's done in the OPD as well. So under a camera, we examine the cervix and we detect if there's any suspicious area. We take a biopsy from there. So the confirmatory diagnosis is on biopsy, and then we proceed with an MRI. And this cancer has stages to it. There is stage 1, stage 2, stage 3, and the most dreaded stage 4. So depending on the staging, the treatments are planned. And we do involve an oncosurgeon or an oncologist depending on the staging of the cervical cancer.
And what is the treatment like? Is it surgery? Is it radiation, chemotherapy, all of it? What does that look like?
So depending on the stage, like I said, if it's an early stage, it's a stage 1 cancer, then you can go ahead with a hysterectomy. If the woman's family is complete, she can go ahead and remove her uterus basically. So that is a surgical option. In case you are in that stage 2 to 3, then a little more drastic surgery is done. The whole uterus, tubes, ovaries, your pelvic lymph node dissection is done. And you may require some chemotherapy and radiotherapy.
So all of these organs are removed?
Yes.
Okay.
Yes. And lastly is the stage 4, where mainly then, chemotherapy or radiotherapy has to be done. So depending on the staging, the treatment is planned.
And is this cancer generally like one of the more fatal cancers, or is it more treatable?
It's one of the worst cancers. Like I said, once you have it, and if it's at an advanced stage, that is, I think, you'll have bowel problems, you'll have bladder issues, there is a very necrotic tissue growing in your pelvic area, which is, like I said, eating up your organs. So it's not, it's one of the worst cancers, I would say.
So if someone's had cervical cancer, they've gone through treatment, they can have children, they can't have children.
So, if it's diagnosed at a very early stage, and it's a very small growth, less than 5 millimeters, we are only going ahead with a leap surgery or a trachelectomy. Like, trachelectomy is only removal of the cervix. We leave behind the uterus. So that is one option. Under supervision, definitely the woman can go ahead with childbearing. But if we are going ahead with a total hysterectomy, we are removing the uterus, then the woman can preserve her fertility by freezing her eggs, and then going ahead with a surrogacy later on. So that is one option.
So there are some options if you would like to have
Yes,
children.
definitely.
There are some myths around cervical cancer, and it has a lot to do with sex and your sexual partners. So is it true that if you have multiple sexual partners, you're more likely, or you can become more likely to get cervical cancer?
Yes, so definitely. I think that's a very important factor. Having multiple sexual partners will definitely, expose you to having more the HPV virus lasting more in your body.
How would that?
Yeah, so you're getting exposed to, you may be exposed to a high risk partner. You never know. Like I said, there are no ways to test in the men. So you never know how much you're exposing yourself. If you have multiple partners, you will definitely be at a high risk to have HPV for longer time in your body.
Okay.
Also, if you start intercourse at an early age, that is also then you again have, you're exposing yourself to the HPV virus for a longer time. You have the chances to expose yourself for the HPV virus at a longer time. And again, if your partner is a high-risk partner, if he has multiple partners, then again, you are at a high risk.
Higher risk.
Yes.
So sort of works like an STD.
Yes,
the more
definitely.
partners that you have,
Yes.
the higher risk you are.
Yes.
When we go back to talking about prevention, when somebody decides to go to a gynecologist to get tested, how often should they get a pap smear done? How often should they visit a gynecologist? How often should they get screened? What is like the general hygiene for something like this?
So, once you are sexually active, you must visit your gynecologist at least once a year. That is the norm. And for pap smears and screenings, we recommend that if you're doing a pap and HPV DNA, do it once in 5 years. And if you're doing only a pap smear, so you need to do it once in 3 years. Yeah, so if there is a history in your family, like your mother or sister had cervical cancer, then definitely you are at a higher risk of getting that cervical cancer. In those cases, you can do your screenings a little earlier, say yearly screenings. So yeah, that is the norm.
And what sort of price tag comes attached to these tests?
The pap smear and the HPV DNA's combined testing could be somewhere between 2,000 to 3,000. And only a pap smear could be somewhere around 1,000 rupees or 1,200 rupees.
Other than getting the tests in terms of their lifestyle, in terms of their everyday habits, what should it look like?
Yeah. So, there are certain things which you can incorporate in your lifestyle to prevent this HPV virus entering your body. So, firstly is, having a good immune system. So, you should have a healthy diet, exercise regularly, eat your fruits and vegetables, have your supplements. So, these things really matter. And if your body's immune response is good, you will not catch the HPV virus very soon. Secondly, your sexual life. That is, like I explained to you, that many high-risk factors are there. So, try to have single partners, because having multiple partners will definitely expose you to a range of HPV viruses. You must have protected intercourse. That is one thing, because using barriers will prevent it's a sexually transmitted disease. So using barriers will definitely prevent the transmission of HPV virus.
So have a healthy lifestyle, have
Yes.
safe sex.
So that is the reason, we say that as much as possible, try to prevent this cancer. And if you've not taken the vaccine, at least do your screenings on time. It's high time that cervical cancer could be eradicated by using the vaccines. So I think that is one message that, we should give to the audience, that if it's an eradicable disease, we must go ahead and vaccinate everyone.
I'll just ask you one last thing. Is there anything else that you would want to share on the cancer, on the vaccine, on the treatment, on anything to our audiences?
So, I just want to say that I generally educate all the young women who come to to my clinic and to the hospital that your regular screenings are very important, and even the vaccinations are very important. There are times when women, delay and they take it lightly, but you must understand that, going through that pain of cervical cancer, what kind of a disease it is, once you know about it, I think you will never delay your vaccinations and, delay your screenings. So please go ahead and get your screenings done on time. And for young children who are more than 10 years old, I would request all mothers to get their children vaccinated.
Thank you so much for
Yeah.
talking to Brut, Doctor.
Thanks. Thank you so much.